I'm Dr. Jeff Smith, author of the book, Living Pain-Free, It's Your Choice. That means I literally wrote the book. Did you hear me? Wrote the book on living a pain-free, chronic pain, chronic disease-free lifestyle. We're here to talk about that today, how our clinic treats our patients metabolically and neurologically to rid themselves of these problems. Let's go through this a little bit. Now, some of you out there are watching this video, or some of you are watching it for somebody else that might have a chronic condition or a chronic health care disease or something of that nature, that you've tried medicine, you've tried drugs, you've tried different types of doctors and surgeries, and just you're not getting over the problem. Or maybe you've taken so much medication that now you're sick from the medication. Maybe the medication makes you partly well but not completely well. You ever wondered why you can't completely get over that problem? Why you can't completely rid yourself of that disease, that chronic pain or that chronic disease? We're here to talk about it today. In our office, we treat our patients both neurologically and metabolically. Now, what that means is essentially we analyze the brain, the central nervous system, and all the metabolics within the body, hormones, blood work, panels, all kinds of things, immunity, stresses, all those kinds of things. We have a solution to chronic health pain, chronic disease, and chronic disease. Okay? We look at things from a metabolic and neurological standpoint. Now, what does that mean essentially? When you come in to see us, we're going to do 4 basic screening tests. Those screening tests are going to tell us whether or not you're a candidate for our program or not. And if you are, we may be able to help you. I'm here to tell you we leave no stone unturned. If you have chronic disease or chronic pain, we are going to test you, examine you, do things that most doctors don't know how to do to figure out what is the actual cause of your problem, not just why you're having those symptoms. Okay? For example, when patients come in with chronic pain or chronic disease, we'll run blood work on them. Okay? Thyroid panels, complete metabolic panel, lipid panel, or CBC with autodifferential. Now, I know I hear this all the time. Doctor, I've had those tests. My doctor said they're fine. Why are you still sick? Give you an example. Thyroid gland. The laboratory on the sheet of paper you get says it's normal from 0.5 to 5.0. Do you know what functionally normal is? Or what is optimal for you? It's 1.8 to 3.0. If you're 1.2, the lab says you're fine. Why are you still sick? Because 1.8 is the minimum. You're hypothyroid. You're not having enough thyroid in your body. We're going to run these tests and analyze them. These conditions can result from years and years and years of metabolic or neurological problems, problems in the brain or problems in the body that just aren't being addressed through medication. We're going to run sensitivity testing on our patients. Why do we do that? Well, for instance, if you're allergic to wheat, gluten, milk, soy, eggs, or dairy, your body essentially is going to have an allergic reaction every time you put those things in your mouth. Now, how do you know if you have those things? You run the test. You have to run the test. Okay? Here are some examples. For instance, if you have any sensitivity to those things at all, gluten, soy, milk, eggs, or yeast, you could have chronic pain or chronic fatigue, which is exactly what we're talking about today. You could have frequent indigestion, that feeling of bloating after you eat, which is just horrible. Everybody has that feeling. Frequent loose bowel movements or constipation. You could have ulcers in your mouth. You could have sores inside your mouth, or you could vomit often. That's just from having a sensitivity to those types of things. And unless your doctor knows to run those tests and knows how to analyze them, you're never going to know. You're never going to know. And if you have those sensitivities, you better believe it's going to affect your chronic pain or your chronic disease. Oh yeah. Adrenal stress index test. It's called an ASI test. Why do we run that test? Well, if you suffer from insomnia, for example, this test will measure your cortisol levels. Okay? Your cortisol is important for a lot of things. For one, if you have too high of a level of it in your brain, it will eat away at your brain tissue. And it's also the single thing that's responsible for making you wide awake at 3 a.m. at night and dead tired at 3 p.m. in the afternoon. That simple test tells us what those levels are. Okay? Autoimmune disorders. Now, autoimmune conditions are very serious. Okay? How do you know if you have one? Well, there's a test for that. For instance, Your autoimmune system in chronic pain or chronic fatigue or chronic disease patients, if you test positive for the thyroid antibodies TPO and TPG, if those are in your body and they're too high of a content, you're suffering from Hashimoto's disease. Hashimoto's is an underactive thyroid, and it's not because you don't have a good working thyroid gland, because you don't have enough thyroid in your body. It's because your immune system is attacking your thyroid. So you don't treat that condition by giving someone thyroid medication. You fix that condition by treating the immune system, which is attacking the thyroid gland. I hope that makes sense, because you want to treat the cause, not the symptom. If you suffer from tissue antibodies, for instance, sometimes parts of your immune system flat won't work. We need to know why. Why is that? Okay? We need lymphocyte subpopulation, Th1, Th2 cytokine panels, and natural killer cells. Those immune panels give me an in-depth picture of exactly what's happening in your immune system and how your immune system is affecting both your chronic disease or chronic pain problem. H. pylori, Helicobacter pylori, it's a bacteria we all have in our stomachs. Okay? We should have a certain amount of it. When you have too much of it, things get out of balance, out of proportion. For instance, if you have too much of that in your body, you'll suffer from what's called leaky gut syndrome. Leaky gut syndrome is a condition where altered or damaged lining of the bowels caused by antibiotics or toxins or a poor diet or parasites or infection can lead to permeability of the intestines, or in other words, your intestines will leak into your body cavity. Now, you know what happens when your appendix bursts? It's the same type of principle. If this is leaking into your system, it's going to make you terribly ill, chronically sick. Okay? Your immune system is what controls that. We also test for neurotransmitters. Do you have the proper neurotransmitters in your brain? Is your brain communicating with the heart, the lungs, the kidneys, the adrenal glands? The neurotransmitters are vital for brain function, because a decrease in those neurotransmitters will cause an increase in pain. So if you suffer from chronic pain and you don't have enough neurotransmitters, your pain's going to be even higher. Okay? Hormone panels. We use hormone panels to check to see if a patient suffers from low progesterone or low testosterone in males. Yes, males have hormone problems too. Very common. Okay? That can include symptoms like depression, fatigue, fogginess of the mind, or mood swings. If you have chronic problems like a chronic disease or a chronic pain, your hormone levels will vastly affect that condition. And without the proper test, your doctor won't know how to repair it. Okay? Inflammation. We test for inflammation. If your body has inflammation in its brain, it'll literally kill you. You have to run the test to find out why. And more importantly, how do you fix it? Glutathione. We need to know if you have enough glutathione in your body. Glutathione is basically the mother lode of all antioxidants, and without enough of that in your system, you won't be able to fight off disease, cancer, infection, nothing. Nothing. Glutathione, for instance, is given in only 3 ways. If your doctor tries to prescribe it to you in a pill form, don't take it. It's worthless. You can use it as a cream, which is how we use it in our office. You can nebulize it or breathe it, or you can take it via suppository. You cannot take it by mouth, and if your doctor doesn't know that, it's not going to help you. That's how we have to analyze why in the world do you have chronic pain or chronic disease and it's just not getting better despite your doctor's efforts or multiple doctors' efforts. We have patients come from Mayo Clinic down to see us because they spend $30,000 in tests and don't know anything. You have to know how to take the right tests. The doctor has to know how to interpret those tests. And more importantly, what does he do to fix you? Okay? Neurologically, how do we treat the brain if we decide we have a right brain or a left brain problem? For instance, maybe chronic pain down your left leg. Okay? If you have chronic pain down your left leg, the right brain is responsible for that. You need treatment to the right brain. How do we treat the brain? We use oxygen. Oxygen. Your body needs 2 things: fuel and activation. Fuel comes in the form of oxygen and glucose, or sugar, which is what you put in your mouth. Activation is treatment or stimulation of the brain. If part of the brain is dying, the way you treat it is you wake it up, you treat it, you activate it. Okay? Brain-based therapy uses techniques specific for treating whatever part of the brain we deem is malfunctioning or not working at an utmost level. So we use things like spinal decompression, laser therapy, electrical stimulation therapy, vibration therapy. Sometimes we use an interactive metronome. Okay? We use concentrated oxygen. We use exercise with oxygen. Okay? That's how we treat and wake up parts of the brain that are under functioning. You have to ask yourself 4 essential questions before you come and see me. Okay? We need to know 4 things about your chronic disease or your chronic pain. How has your chronic health condition affected your job, your relationship, your finances, your money, your happiness, or your sleep? How's it affecting you? What does it cost you? What does it literally cost you in terms of time or money or sleep or your happiness? What's it cost you? Where do you picture yourself in the next 1 to 3 years if you don't have this condition properly taken care of? Now, if you're watching this video, whatever condition you have, I'm sure you've had it for a few years because no one's been able to help you. Okay? And number 4, what is it worth to you if we can improve your condition? What is it worth to you in terms of your time, your effort, your meaningfulness in life? Can you put your effort into doing what we ask you to do? Is it worth enough to you that you're willing to help me help you, help yourself? Because if it's not, quite frankly, we don't want to see you. You know, you can keep taking your pills, or you can keep taking your treatments, or you can keep seeing those doctors that aren't helping you. We don't want to deal with patients like that. Now, I'm not trying to be mean about it, but we only want to help the people that are qualified patients, that can pass our 4 screening tests and have a willingness or a real want to get better. Because if you don't, we don't have time for that. Okay? In this office alone, last year, we treated 18,203 patients. If you don't want help, or if you want someone to do it all for you, don't call us. Don't call us. But if you want our help, get a copy of this book, Living Pain Free. It's your choice. It is a choice. Call our office. What do you need to do? If you're serious about getting help, if you want someone to finally end this condition or end this chronic pain or end this chronic disease, call us, 271-6992. Make an appointment. Come in for an evaluation. Let us run those 4 screening tests on you and see if you're a good candidate or not. If you're not, I can't help you. If you are, we can change your life. You can visit our website and hear from some of our other patients that have gone through our program and successfully changed their life. It's www.thechronicpainclinic.com. Again, www.thechronicpainclinic.com. Now, if you call our office at 271-6992 and make an appointment, we'll actually send you a DVD. It looks like this here. This DVD will be specific to whatever condition you're interested in learning about. On this DVD, we will tell you before you ever come see us exactly how we're going to help you. Okay? We'll also give you some paperwork to take home. If you have any blood work that you need me to evaluate or look at, bring it with you. Okay? We need that information. I'm Dr. Jeff Smith. I'm here to help. If you want our help and you want to change your life and change everything about what you've had experienced up till this point in time, to get rid of your chronic pain, to get rid of your chronic disease, call us now. I hope to see you in the future. Have a great day. Go ahead.
Okay, I'm Freda Porter from Bentonville, Arkansas.
All right, Freda, what condition are you being treated for in our clinic today?
I have collapsed vertebra in my neck and herniated discs in my back.
Okay. How long have you had those conditions?
Well, probably longer than I knew, but I've been here 2 years now.
Mm-hmm. Okay. And how has your treatment benefited you so far, and what kind of experience have you had in the clinic?
It has rendered me pain-free for the most part. It has allowed me to continue my job. It has just changed my life.
That's a big one, being able to work, isn't it?
Yes, it is a very big one, very important.
All right, thank you.
Okay.
I've been coming to Dr. Smith for quite a few years for back problems. And when he mentioned fibromyalgia, I said, I've had fibromyalgia for 16 years. So he suggested the brain-based therapy. From the day I started until today, I have had not even a hint of fibromyalgia pain or symptoms. I just can't thank Dr. Smith and his staff enough. And